wanted to sit down and chat with you guys today about epidurals. I wanted to talk to you about epidurals because, like any medical procedure, it has both pros and it has cons. While it definitely can ease the pain of childbirth, it can also have some side effects, and for some people it doesn't work well and just is not a great option. Today I wanted to talk to you about options for managing pain during childbirth, and today I just want to offer information and not judgment. So let's just talk facts and let's stay away from judgments, because if you had an epidural, that's awesome. I also had one with my first child, so I get you. I also had a natural or pain medication-free childbirth with my second child, so I kind of have an experience from both sides of the story. So I wanted to just kind of share some options that you guys might have available to you, and some of these options will be available in your area, other ones won't. These are just kind of a breadth of information, so if something in this video interests you, make sure that you talk to your midwife or OB or other healthcare provider and see if it is a good option for you as far as managing pain during childbirth. The pros of getting an epidural are kind of twofold in my opinion. So the first is that it can ease the pain, and I will not lie to you, childbirth can be anywhere from pretty mildly uncomfortable to excruciating. It really depends on you, your body, that kind of thing. I've heard so many different stories. I actually talked about, you know, my experience having a natural labor and if it hurt or not for me, and I'll link that video for you down below. But in the comments on that video, I've heard from so many different women and they have shared their experience. So if you are someone who is prone to like more painful labors or that kind of thing, an epidural might be a good option for you. An epidural is easily accessible. That's the other pro in my opinion. So it is an easily accessible form of pain medication in most hospitals. If you're talking about having like a home birth or birthing in like a birth center, an epidural might not be an option because it might not be easily accessible there. But if you are planning a hospital birth, an epidural is a good option potentially, depending on you and your body, because it could be easily accessible. So those are kind of the two pros in my opinion. If you have other pros that you think about the epidural, feel free to leave those down below. I'd love to hear them. So also some cons with the epidural, just kind of from my research and my personal opinion. The first one is that your movement will typically be restricted. So in most cases when a mother gets an epidural, she needs to lie flat in her bed and she's not able to, you know, move into different birthing positions or get up and wander the halls. I have seen something that's been kind of up and coming recently called a walking epidural. I don't have a ton of information about that, but if you've actually had one and have experience with that, feel free to leave that down in the comments below. I would love to know more about that, so let me know. Because of this decreased movement, an epidural can prolong labor. Labor is kind of an active process, so if you're moving and using gravity, your labor might take less time. But if you are restricted in your bed, your labor might take longer. So that is definitely another con in my opinion. An epidural is actually known to cause hormone disruption during labor. So because your body isn't getting the signals from sort of the pain and, you know, feeling your baby move down, that kind of thing, your body can actually be disrupted when you have an epidural. So I will leave an article down below where you guys can get more information on this. I am not a medical professional. This is again just from my research. Definitely look into this if an epidural is something that you are considering. When mamas have an epidural, depending on the person, they can have a more difficult time pushing, especially if the epidural is on like full force and you can't really feel anything. If it's working effectively for you, you might not be able to push effectively. First time moms especially have this problem because pushing is new. If you've never had a baby before, pushing is a new thing, and so you don't exactly know what to do, and doctors and nurses might be trying to coach you and tell you, but you might just have more difficulty because you can't really feel what your body is supposed to be doing. One of the major risks that has always concerned me about epidurals is that it can give you a dangerous change in blood pressure. So I've seen moms in labor whose blood pressure have dropped because of their epidural, and the doctors have to quickly turn it down or figure that out, or, you know, medicate in other ways. So at that point then you're getting more interventions, more medication that can make the process seem a bit more like hospital-like and not as like just having a baby kind of process. I'll leave an article to that as well if that's in your interest area that you want to check it out or research. A lot of moms who have an epidural report increased trauma to their perineum. So your perineum is that area between your anus and your vagina, and it can tear during labor. And if you can't feel what you're doing, then you can tear pretty good. Your doctor may even offer to do an episiotomy, that kind of thing, especially because you can't feel anything, and maybe to get the baby out faster, that kind of thing. If you have an epidural, you're at more risk to have greater trauma to your lady bits. And studies do show that moms who have had an epidural have a more difficult time establishing breastfeeding. A lot of times, if that labor takes a lot longer, babies can come out a lot more sleepy and they are not ready to nurse. And so even if you get that good skin to skin contact, it might, you know, be delayed. And so then baby is late to start, as it were. Again, it disrupts those hormones that you naturally have in place. You might not be quite as ready to breastfeed when you're having an epidural. However, I know that a lot of moms who are researching during the pregnancy process who are thinking, you know, I don't necessarily want to have an epidural, but I don't necessarily want to have a 100% natural delivery. Those are not your only two options. I'll give you a few options that I learned about during my research and that I was actually planning to utilize a couple of these, but I had some medical issues that prevented it. The first one is hiring a doula, and this might sound kind of crazy to you and you're like, well, that's not really gonna help me not feel pain. It may actually help you not feel pain. If you have someone who is experienced with labor support, then they can offer you just some support in general, and they can kind of guide you into positions that might be more comfortable. They can give you more like breathing techniques that might be more helpful. So they can just kind of make it more comfortable for you when you're in labor. The next thing that might help you during labor is movement. And this might seem, again, kind of silly, but it helps so much. When I was able to like be up and moving in my labor room during my second delivery, my pain decreased. My pain decreased at a very rapid rate. So moving into different positions can help either move baby down into your pelvis or move them off of a particularly uncomfortable place. So movement is another way to manage your pain. Another way to manage your pain, and I was actually looking into this, is to use water. So whether it's standing in the shower, getting in a tub, all of those things can definitely decrease the pain of childbirth. I was not able to use these things because I had high blood pressure during my delivery with Harrison, but I was definitely looking into it, and I think that it would have really helped. If any of you moms used water or anything like that during your labors, feel free to leave that down in the comments below so we can share experiences as well. There are also options that your hospital can provide that are not necessarily an epidural but can take the edge off, such as the gas and air. I know this is a popular option in Europe and in the UK especially, but a lot of hospitals in the US are also getting this, so it's a little bit of laughing gas to kind of take that edge off. I know a lot of moms who've used it and have had great results. Also, you can have low doses of some pain medication. It doesn't last for very long, but it can take the edge off if you are maybe like right close to pushing and you just need a little bit of a break, that kind of thing. So those are good options as well, but be sure to do your research for sure. And then I just have a couple of tips around like laboring and epidurals and that kind of thing. If you are planning to delay the epidural at all, make sure that you let your care provider know that you want to delay it as long as possible. You want to explore their options, that kind of thing. Make sure those things are communicated to your care provider and also written down in a birth plan. That's super important. If you do go ahead and opt for that epidural, make sure that you have an excellent nursing team that are supportive of you continuing to be able to move around during labor, or them helping you to move during labor. So make sure that they are willing and able to help you move into different positions to help move your labor along, that kind of thing. And make sure that you communicate those needs early on, either in your labor or before you even give birth when you're going to your prenatal appointments. And then I just have a few questions that you might want to ask your care provider as you are researching and getting more information. So the first one is, what are the risks and what are the benefits of having an epidural and not having an epidural? So make sure that you talk to your care provider about that specifically, and make sure that you maybe even do some internet research or talk to other moms, midwives, doulas, get a second opinion if you don't feel comfortable with the answer that your care provider has given you, and don't be afraid to ask questions. The next question you should ask is, what are my alternative pain management options in the birth setting where I will be? So make sure that you get a full list of what your options are, maybe even before you go on your hospital tour, or maybe even before, you know, like in that very first appointment would be a great time to ask that. So then you have plenty of time to research, plenty of time to make your decision about how you would like to manage pain during your labor. The next question you want to ask, if this is something that you're interested in, is, does the hospital staff offer support to women who choose to not have an epidural or a natural delivery. Sometimes I've seen in hospital settings that they can get kind of pushy. They can continue to ask if the woman would like to have an epidural, and if she's in a very vulnerable, painful place, she might just go ahead and give in, but even if that's not something that she originally wanted. So make sure that the staff is going to respect your wishes and follow the care plan that you have worked out with your provider. And then talk to your care provider about a doula. So maybe ask, like, does a support doula help with managing pain during labor? You can ask something like that. But definitely talk to them, maybe even interview a few doulas to see if it would be a good fit for you. I loved my doula. I still love her. She's actually a very close friend of mine now, and I would use her again and again if we have more children. So I absolutely love her, and I think that building a relationship with a doula during your pregnancy and labor and that kind of thing is amazing. So definitely look into that one for sure. I may be a little bit biased, but I highly recommend having a doula. I hope this video was helpful to some of you out there, and if you have other questions that I might be able to answer, feel free to leave those down in the comments below. Also, if you have any, continuing questions that I could make another video about, feel free to leave those down below. I'm always happy to take video requests. That's a wonderful thing about this community. If you are new here, welcome, and don't forget to hit that red subscribe button on your way out. I would love to have you with us. If you are one of my current subscribers, thank you so much for being here. I absolutely adore you guys, and I know I say that every video, but I mean it. Like, you guys are the best thing on the internet, I swear. You're the best thing in my life. You are my friends, you are my internet family, and I adore you. So if you are currently subscribed, I thank you so much. I would encourage you also to hit the bell notification so that you get notified every time I post a video. And if you want to connect with me outside of YouTube, I do post on Instagram, Twitter, and Facebook, or on my like page as well. And we have a PO box if you would like to send us a holiday card or send us a letter. We would love to hear from you. And by the way, you guys, have fun today.